Okay friends, now in this video we are going to talk about the allopathic medicines for constipation. So if you are having a problem of constipation, this is a big enemy to many people, okay, and people don't take it seriously sometimes, most of the times, but constipation is associated with 70 to 80% of the patient nowadays due to the food habits and the behavior that we are going through. Now the constipation can be of two different types. It can be acute or it can be chronic. Okay, now there are different problems associated with constipation, and we generally don't go to doctors until or unless there are issues like pain or associated problem with it. Constipation is associated with many types of problems related to your rectal area, and that can be fissure, that can be piles, that can be fistula. There are many more things associated with it. Okay, mostly fissure, and then it can develop into fistula. So those are the problems. When those problem comes in, then people go to and rush to doctor and rush to surgeon, but those are too late. So if you have acute constipation, most things that you need to do as a tips that I'm going to say is mostly drink plenty of water, drink a lot of water, okay, and high fiber diet, high fiber diet. This is what you need to do. And exercise, regular exercise, lots of vegetables in your diet, okay, and do not eat most sugar. You should go away from sugar, no sugar most of the time, okay. So these things, if you do regular exercise, walk and all, if you do these things, then constipation helped a lot. Because these things, people say like, you know, write some medicines, okay, we don't need to listen to your like all this knowledge and all. Yeah, I'm going to write medicines, but these are the things. If you don't do this, then constipation will never go away from your life, okay. So medicines will be there to help you in your acute phase of constipation, but you need to follow all this to be fit for your lifetime, okay. So the typical medications that we actually prefer for constipation, for acute constipation, is normally like if it's only constipation, you know, there are two types of things. One is that there is hard stool, you know, normally stool is there but it's hard. And second type of situation is that there is no passing of stool for 2, 3, 4 days, no passing of stool, like that. And that is associated with many other problems, like, you know, upper digestive problems, gastric problems, and many other problems associated with that. Now if it's normal, like if it's hard stool, it's not like you have a regular stool but it's hard, in that case it's well managed, it's not that difficult to manage, and you don't need to recommend any test for that. But if you are not able to pass stool for 2 days, 3 days, 4 days, 5 days, and afterwards the stool, like 4-5 days later, it's so hard and cracky, in that case we may need some test recommendation in here. And the test recommendation that we are going to go for is normally stool test, okay, the routine stool test we can go up with. And that's all. That's going to tell us something more about what's going on there. And if this problem is persistent, if it's chronic and more than 2-3 months, then we are going to do USG of whole abdomen USG we are going to check for, okay. But apart from that, normally if it's a hard stool, then we are going to take some what I can say as lubricant, okay, a lubricant that will help you to ease the that can make your stool soft, okay. And generally there are many types of lubricant laxative that is available in the market, either in tablet form or liquid form, okay. So for medicines, I can give you liquid paraffin like Crema Lax, you can take tablet that you can take, or Dalcolex. But there are problem with these two tablets is that many people may notice a cramping, abdominal cramping associated with it. Normally take 1 or 2 tablets after food, after dinner, okay. That's a normal situation. You can take that for 14 days, 7 to 14 days. Now the dosage, 1 to 2 tablet, you first take small dosage. If it's not working, then you can slowly go up. Apart from that, we have other things like syrup, okay, and the syrup is Dufalac. You can take Dufalac. You can start with 10 ml of dosage. You can increase it up to 30 ml, okay. Again, after food, after dinner. Okay, that's what you need to take. Again the same thing, 14 days to 1 month. But remember to increase the dose slowly. Okay, directly should not take 30 ml dose. It may cause a lot of cramping and you need to go much frequently to the toilet. Okay, that may be a problem. And if these things are not working, then you take liquid paraffin, which is brand name Cremafin plus. You take Cremafin plus syrup also, 10 ml, max to max 20 ml, not more than that. Okay, again the same thing, 14 days to 1 month. Again after food, after dinner. Okay, and while taking these medicines you should take a lot of water, because the job for Dufalac and this Cremafin plus is to hold water in your intestine, large intestine, so that your stool becomes soft. And if you don't want to take this hardcore medications, then I would recommend a much better thing, that is Crema Diet, which is a simple fiber supplement. Okay, this is a fiber supplement. You take this supplement 2 teaspoons in a glass of water. Okay, again for 1 month at least, you take it for 1 month, again after food, after dinner. Okay, you should take that, and again take plenty of water with all these things, but should not take everything. Either you take this or this or this or this. Okay, if your constipation is milder, only take this fourth medicine. If it's secondary, then take 1 or 2. If it's even harder stool, then take the third one. Okay, keep that in mind, not all of that. Okay, these are either or, so or. Okay, in all these medicines there are ors. Now the thing is, sometimes it may be associated with other problems. There are some physical issues may be associated with it. Physical issues, something like painful. If you have pain in the anus area, then maybe it's probably fissure. If it's fissure, then you need to use xylocaine ointment if there is fissure from constipation. So I can put it here, Lox gel. Apply Lox gel thrice, 3 times. Actually it's not related to food, 3 times per day. Okay, apply that after passing stool. And if it's fissure means small tear in your annular area, then you can also take capsule Basiclox. Okay, 500 Basiclox 500. You should take that 3 times a day, after food. Okay, for 5 days. And along with that, take tablet Combiflam. Tablet Combiflam 1. You also take that for 5 days after food, twice a day. Okay, and this is pretty much it. Okay, if take this 3, 5, 6 or 7, these 3 medications if you have anal fissure. We'll have a different video about different prescription about anal fissure later on. We'll be talking about fissure in much details there, but this is the most common things that people take. Okay, normally you go to a doctor, visit someone, say that you have constipation. People say that take lots of fiber and water, regular exercise, it will suffice. They'll give you like this Crema Diet. This is just Isabgol husk. So any brand name, Crema Diet, and any of the Isabgol husk or any other powder related to that, Ayurvedic powder you can take, but you should not take something which creates a lot of cramping. I tested Crema Diet. It works very well. It causes minimal cramping, and you can only go your normal routine of your bowel movement. You can follow that. But there are medicines which can alter your bowel movement. Like if you normally go once or twice, it may cost you to go 4 or 5 times a day, which is not good for person who is working. So it's not okay. So this is okay. But if it's not working well, if it's not relieving your pain, then definitely see a doctor. And if it's related to fissure, definitely see a surgeon, a general surgeon or a gastrointestinal surgeon. And if this is chronic constipation, then check the stool and also whole abdomen USG to check for any other problems later on. Okay, so if you have constipation, follow this. It's going to help you ease the problem quite well. Thank you everyone. If you like this video, please hit the like button, share this video and subscribe to our channel to get more videos like that.